Welcome to this episode of the American Medical Podcast with our host, Dr. Michael Kanosky, a board-certified plastic surgeon, hair restoration specialist, and medical director of AMP Mississippi.
A lot of times the whole aging wellness area felt like this is just inevitable. This is just what happens. Mm-hmm. And I think that we're kind of seeing now that, especially you mentioned from the hormone replacement side, I think men are starting to understand, and what a lot of our message is, maybe these hormone levels aren't dropping because you're aging, but maybe you're aging because your hormone levels are dropping.
That's right.
And so when we can measure these things and then give the patients the opportunity to have some options to see what they can do with the idea of we know that aging is inevitable, but there are certainly better ways that we can do it. And so wherever you are in the walk, if you're earlier, if you're older, being able to maximize where you are at the time is valuable, and I think something that we can help guide these men through.
Research and results have shown in more recent times, the last 10, 20 years, that one of the most important hormones in your body is testosterone, and that it does many, many things, a multitude of things. It doesn't just have to do with sexual performance. That's one thing, yes, and we've all heard about that. But testosterone is necessary for everything from having muscle growth, quality and thickness and density in your bones so that you don't get osteoporosis. It keeps us active, and it allows us to have everything from healthy skin, prevents us from aging prematurely, keeps our lungs functioning at top capacity, keeps your liver functioning, your kidneys and so forth. So it helps in that regard. It helps you to heal when you get a sprain, a cut or a scrape. People with low testosterone don't just feel fatigued, and yes, they may have erectile dysfunction problems as well, but they don't heal wounds very well. They don't heal or mend if they injure their body or strain their body in some way. They're more likely to have heart disease, everything from congestive heart failure to heart attacks. They don't breathe as well. Their lung capacity goes down decade after decade after decade. And so all of these things are affected by testosterone. And by the way, women have testosterone too, just like guys have a little estrogen. It's just the ratio is so much higher. So guys have to have a lot more of it to be able to carry out these functions in our body. Lack of testosterone leads to a lot of premature health problems, and all of these studies have been done by very reputable multi-center places in the country. And so the use of testosterone has just burgeoned over the last few years, and we know it's an extremely important part of our lives. One of the real reasons guys tend to gain weight is that as time goes along, as we go through the years, we become a little less active and our metabolism tends to drop. We don't burn the calories the way we used to. And the chief reason for that is we lack testosterone. You give somebody testosterone, and a guy automatically is going to lose some weight. It's almost inevitable that you're going to lose a few pounds. What's interesting is those same guys that drop 10 pounds gain 5 or 6 back pretty quickly, and that's because of muscle. But the waistline is a lot thinner, and so that's a great thing. And they feel better, their lung capacity is better, and their heart can, work harder for them. They're overall feeling better, and their body's doing better. And so weight loss is not just a question of eating less and eating sensibly. Sure, that's part of it, and we stress that too. But testosterone and supplements that help you with testosterone are key. If you don't have those, you're going to go on one of these crazy diets I hear about, that you restrict yourself to so few calories or so few carbohydrates. You're not going to live on that for the rest of your life. You're going to lose a little weight, then you're going to get off that diet and you're going to yo-yo back up. That's what happens. And that's one of the things too, that goes for both men and women. And that's one of the fallacies about the diet industry. They tell you just eat these very few calories and you're going to do better. That's not really always true. Well, steroid use has been used for various things, healing and bulking up and so forth. There are a lot of negatives to steroids, and as you and I both know in our practice over the years, there are people that have taken steroids and they've had problems. It can cause your diabetes to flare, it can cause your blood pressure to go out of bounds, et cetera, et cetera. Testosterone does not do that. It keeps you, because it's what your body is looking to do and craving, whereas steroids are not natural in large doses. Our bodies have a little bit of steroid. We keep them around, but sometimes we get a lot of them for various treatments, and it's not always best, certainly not in the long run. Sometimes short-term steroids are, okay, but I don't like to use them in the long run.
To hear more episodes of the American Medical Podcast with Dr. Kanosky and his medical and wellness guests, follow us online. American Medical Podcasts, amplifying health and wellness.